Welcome to What's Now. I'm your host, Christine Napier. This is a show where we focus on what's trending, new research, great products, and more. In fact, today's show is all about your health. Health and wellness has taken on a new priority, especially since the pandemic. And right now, we've got new research about things such as overactive bladder condition, also newborn illnesses, and COVID testing. Up first, though, OAB, or overactive bladder. What do you need to know about this condition? When do you need to see a doctor, and what can be done? Well, let's find out more right now.
With November being Bladder Health Awareness Month, it's an important time to recognize the issues and anxiety impacting nearly 55 million adults in the U.S. Overactive bladder is more common than vision issues, Alzheimer's, diabetes, or breast cancer. Those living with OAB find themselves mapping out their days with the never-ending search for a restroom. And with COVID-19 having closed so many public restrooms, the need for solutions is even greater. Dr. Melissa Kaufman, a Vanderbilt University Medical Center urologist, and her patient, Dr. Linda Brice, a former captain in the United States Air Force and retired clinical associate professor and pre-nursing advisor at the University of Memphis, join us today to discuss potential solutions and sources to help educate about incontinence. Thank you both for being here today.
Thank you for inviting us.
Yeah, greetings from Nashville, Christine.
Well, greetings from Park City. Looking forward to talking more about this as it affects many, many people. Dr. Kaufman, let's start with you. Explain overactive bladder.
Well, that's a wonderful way to start the conversation. Really, overactive bladder is a group of symptoms that a person may experience that's really characterized by urgency to urinate, which is a sudden and very compelling desire to need to urinate, which is hard to defer. This is often associated with a frequent need to urinate, both daytime and nighttime, and sometimes even with leakage of urine.
And Dr. Kaufman, what causes OAB and how does a person know they have it?
Yeah, excellent point. There's a wide variety of issues that can result in these types of bladder symptoms, but let me reassure your viewers now that very seldom are these things imminently worrisome. Certainly, there's associations with aging, with hormone changes, with prior surgeries, but sometimes something even as subtle as a back strain can result in these types of overactive bladder symptoms. Now, it is not, though, an expected or a normal part of aging. And as you mentioned, although this is not anticipated, it is exceedingly common, with almost 1 in 6 Americans afflicted with these types of bladder symptoms, both men and women. And really, these symptoms can range from something that is bothersome to something that's debilitating. Even at that level, what I find is that many people are reluctant to seek care because it is an intimate and very delicate topic to discuss. I mean, Dr. Brice, what finally catalyzed you to seek care?
But it took me 4 years to get up the guts to go talk with my doctor, and I'm in the healthcare field, so I know how people feel out there. It took gushing urine everywhere, not knowing when it would happen. It took trying to find bathrooms. You had to map out your life according to where the bathrooms are. And now with COVID, as was previously said, so many bathrooms are closed. And when you've got to go, you've got to go. And when there's not a place, it becomes very anxious building. But part of my problem was also the fact that I was teaching nursing school and my classes were 2 to 6 hours long. So I had to constantly have breaks for me to run to the bathroom, which then upset my classroom. So the next thing I did was to try and decrease the amount of fluid that I had going in, so the less going in, the less coming out. But eventually that started to take a toll on my kidneys. So I finally, bit the bullet and went to see my doctor. And then when I moved here from Texas, that's when I found Dr. Kaufman. Thank you. She's my hero. She placed the Medtronic's InterStim device in my hip, and this has changed my life 100%. I tried all the medications and all the diets and fluid constrictions, and that didn't matter because mine was more nerve damage. But this new InterStem made all the difference. I no longer have to find bathrooms. I can live my life. I can travel. I can do things. And it made all the difference. And I think what's important is that we need to let those individuals out there, and there's millions that are suffering in silence, to let them know that it's okay to talk with your doctor. It's okay to talk with your family and friends and to find something that will help you find your life again, because life's too short to live going from bathroom to bathroom.
Oh, such important information. Dr. Brice, you mentioned you had a hard time finally going to your doctor about this. Any advice for people who feel like they're in your shoes where you used to be and are hesitant to go to their doctor?
I think that you have to realize that there is a problem, but that this problem is fixable. And to know that if they're not comfortable with their family doctor, then maybe to find a urologist in their area that they can talk to. But being silent is more devastating than it is to have that one initial, talk with your doctor saying, okay, this is what's going on. I don't know, what's causing it, but can you help me? And, it's very important that they take that first step.
Dr. Kaufman, how can we seek more information and contact a health provider about OAB?
Yeah, that's an excellent point. As Dr. Brice said, contacting your healthcare provider, and it may require nothing more than just a discussion, a physical exam, and a urine test to even begin on this treatment pathway. But if you want to find something today, like information that is accurate, that is reliable, we have this compiled at a website, and it's called controlleaks.com/now. And a patient can begin to see, are these the symptoms that I have with my bladder, and how's the best way for me to begin treatments and to get routed to the appropriate provider so we can gain some bladder wellness?
Well, thank you so much, Dr. Kaufman, for this important information about OAB and how people can find help. And Dr. Brice, I really appreciate you sharing your journey with us. I know it'll help many people get that help and also help reduce stigma around this. Thanks so much for your time today.
Thank you.
Thank you
very
so
much,
much,
Christine.